My name is Jerry, and I'm a bilateral eye fuse patient. I've had low back pain for years. In 2020, I had a fusion. Did go through my physical therapy. I actually didn't work for a couple of years, and I had a hard time sitting or standing for more than a half an hour. After a couple of years of doing almost nothing, trying to get my back to heal, I just had enough. And I got an appointment with my primary physician and asked for a referral for Missoula Bone Joint.
My name is Jeff LaPorte. I'm an orthopedic surgeon at Missoula Bone Joint in Missoula, Montana. We're here today to talk about sacroiliac pain and dysfunction. The sacroiliac joint is at the base of the spine and is adjacent to the pelvis. The pelvic part of the bone that articulates with the sacrum is the ilium, and the sacrum is the bottom of the spine. The function of the sacroiliac joint is to transfer weight from the lower extremity to the spine. Patients with SI joint pain usually have pain in the lower back, sometimes in the side of the hip or the buttocks. It occasionally radiates down the leg and is frequently worse with sitting and getting up from a sitting position, as well as lying in bed and turning. Sometimes it's worse with walking on uneven terrain. Sometimes it's worse with just prolonged walking or sitting. The sacroiliac joint has been shown to account for 15 to 30% of patients who complain of low back pain. The prevalence is significant, and if we ignore the SI joint and don't examine the SI joint or don't ask the right questions about the SI joint, then we'll never find out whether the SI joint is actually the cause of the problem. To make the diagnosis of SI joint dysfunction, we have to take a really thorough history. That's the most important part, and that's followed by a physical exam. And the physical exam involves examining the lumbar spine and the hip joint, as well as the sacroiliac joint.
When I seen Dr. LaPorte, he's just very straightforward. He diagnosed me with SI joint dysfunction, went through, showed me where it was at. I'd never even heard of it, and showed me the plan of attack moving forward.
We proceed with injection therapy, the diagnostic and therapeutic injections with local anesthetic and steroids.
After my surgery, I've noticed the quality of life is tremendously better. I'm able to walk better, I can sit longer, I can stand longer, and I'll soon be able to go back to work on a full-time basis. I'm able to go fishing again, which I haven't been able to do for years, and hopefully someday I'll be able to snowmobile and hike again.
In my experience, the patients who undergo sacroiliac fusion have done really quite well, and they're able to return to their usual activities of daily living without significant pain. Throughout my career, I've seen many patients with low back pain that I was really not able to make an accurate diagnosis with. However, about 5 years ago, Dr. Woods, who is an orthopedic spine surgeon here at Missoula Bone Joint, taught me how to examine the SI joint properly and how to listen to patients and really try to figure out whether their low back pain is coming from the sacroiliac joint. And with his guidance, not only non-operatively but with the surgical procedure, we were able to help many patients that I otherwise would have just told them that they have low back pain and they're going to have to live with it. But now people don't necessarily have to live with it. If the SI joint is examined properly and the diagnosis is made properly, we have a procedure that does an excellent job of treating it effectively.
The only thing I do different, if I had the choice, is I'd do it 10 years sooner. What Dr. LaPorte has done for me has changed my life, and I can never, in words, thank him enough.
If you have low back pain and feel as though you may have sacroiliac joint dysfunction, we are happy to see you here at Missoula Bone Joint. We will listen to you, we will examine you, and we will treat you appropriately for the problem.